full council, but it's great to see so many colleagues joining in person in the chamber, especially our public health team leaders, housing colleagues, cabinet colleagues, education colleagues, and obviously governance. I can see the grid view on my laptop for those joining from elsewhere in the borough and perhaps beyond. As is normal, please do draw attention to yourself if you want to speak through me, the chair. So either put up your physical or virtual hands. My colleague from governance, Peter, will obviously endeavour to help me spot you, but please bear with us as there are a sizable number of people in the chamber and obviously online as well. I think there are quite a lot of new members of the Health and Wellbeing board joining. So we've, I think it's Anne McGale, Rosemary Jawara, Marcus Bennett, Stephanie Coughlin, Sarah Brainwhite, and John Williams are attending virtually. We've also got new group director Jackie Burke joining us, as well as some other colleagues. So I think if people can introduce themselves when they speak and do it that way, we can then move on to the agenda, given we've had the late start. But welcome if you've not attended a Hackney Health and Wellbeing Board before. I'm the co-chair, Philip Glanville, the mayor. I chair with Dr. Mark Ricketts on an alternating basis, and obviously you're very welcome. There's no formal theme to the Health and Wellbeing Board today. We're discussing health in all policies across many of the different themes, but if you've been watching before, you'll obviously be aware of some of our more themed meetings, and I think the last meeting was on housing across all aspects of it and was obviously very well attended. I've got apologies for absence from Helen Woodland, Stephen Haynes, and Laura Sharp. I'm just checking they aren't attending as well, because sometimes that does happen. But no, those are apologies for absence I've received. Are there any other apologies for absence?
No other apologies, Jim.
No, thank you. Are there any that colleagues would like to bring to my attention? No, I can't see any, so thank you. Declarations of interest, any additional declarations of interest? I can't see any virtual or physical hands, so I will take that as read. Minutes of the previous meeting. Bear with me a second, I'll just bring it up. Are there any questions or comments from the last meeting? I know it was quite a long and detailed meeting, so sometimes that can be difficult to get right in the minutes, but does anyone have any questions or comments? I'm going to read through page 1, which is the community voice element. Sorry, that's on page 3 if you're looking at the minute agenda, but it's my page 1. Anything on page 4? Page 5? Page 6? Page 7? Page 8? Page 9? Page 10? Or the final page, 11? I'm not seeing any hands, and thank you, Peter, for the very detailed minutes indeed. I think it captures what was a very detailed discussion. Are there any action points, now we've done some minutes for clarity, that anyone hasn't seen picked up, either here in the minute or in the actions log? I'm not seeing anything. So if we move on to the actions log, so we've got the Health and Wellbeing Board action tracker. 2 points to note: there are 2 open actions. Action 2 relates to the housing and health discussion at the July Health and Wellbeing Board meeting. And then there's actions on next steps to be considered in relation to housing and health, with a report back to the board as soon as possible. And I think we all agreed that it was a really good discussion, thinking about the building blocks for a new housing strategy and the interaction with the rescoped Health and Wellbeing Board, and the wish to bring those two things together in the spirit of our forefathers, indeed, when housing and public health were intrinsically linked under Christopher Addison. Housing have sort of come back and said, housing will conduct work to consider how they better identify and evidence the issues and options for response, and develop a working group to take this work forward and collate the evidence base and prepare a response to Health and Wellbeing Board. Do we have a sense of when that sort of might be, James?
James Gard, Interim Director, Regeneration. Thank you, Meglan. But we've set the initial working group has already met, so we've done that. We hope to bring that and the housing strategy and the health and wellbeing work dovetailing together, probably October, November. So we'll bring an interim report back. Hope October. I'll agree that with you. But we've already met. That's going to be some technical.
Brilliant. And then I think Deanna is updating in this meeting on the work from the Member Development Workshop and the Joint Strategic Needs Assessment. So that will be covered off today, and that's why it's closed, I think, or closing is probably the better assessment. I think that's everything in the action log, unless anyone recalls anything from previous meetings. I know there's quite a lot of, in effect, kind of casework and responses that we coordinated with Donna and Peter around some of the previous actions around community voice items. So I know we're really keen to do that. I'd also, taking the chair's prerogative, would highlight a series of tweets I did yesterday from a really fascinating visit with housing needs to some of our most modern temporary accommodation in the borough with Councillor Etty. I'm sure the council will be publicising that in the usual way, in a more official capacity, but I think it's really interesting to reflect, given I know the insight that Healthwatch brought and the debate that Healthwatch and Scrutiny have led before around the quality of our temporary accommodation, but just how much investment is going into it. Three very interesting and different sites. One, Ivy House, which was historically a hostel and was not up to the standards I think any of us would expect, fully modernised and managed by the council on a long lease, with a huge effort around disability access, Wi-Fi, public spaces, access to outside space. A new project working with Thames Reach to provide accommodation for people at immediate risk of homelessness or leaving the street. 12 new spaces created in Clapton, including 2 for no recourse to public funds. Again, high quality accommodation with self-contained facilities as well as shared kitchens. But also Wi-Fi and really great garden facilities and communal spaces. And then finally, a new hostel that's opened in Manor House, which again has more DDA compliant rooms and crucially space for families and temporary accommodation. Now, I think none of us on this call in this meeting want to be proud of developing new hostel space. We want permanent accommodation for our residents. But actually, while there is a housing crisis and all the challenges so many borough residents face, I think to see that improvement in quality, and if you add up all the spaces that I saw yesterday, almost a tenth of the temporary accommodation in the borough I looked at yesterday, and it is of really high quality and what some of our most vulnerable residents and families expect when they face housing crisis. And I know that there's an appetite within the service, but also with public health and housing colleagues to make sure that we continue that investment. We wrap around the support to residents, because it's not just bricks and mortar. And that's obviously a conversation we've had with health and adults and children's colleagues as well. But I would recommend that too, and I think I could extend it to anyone on behalf of housing needs colleagues from anyone in the council to make sure they see those facilities for themselves. Unless there's anything else in the action log, I will move on to the community voice section, and I think invite Lauren and Claire from VCH Hackney to present their agenda item on the Volunteer Centre Hackney community programmes. And obviously at Health and Wellbeing Board, obviously pay tribute to the incredible work that the voluntary sector and the volunteer effort has done in Hackney, both large and small micro-organisations and mutual aid, a huge network of contributions from everything from work with community pharmacy through to the humanitarian response to COVID, to the Hackney Vax Pack, and so much more. And that is obviously why Lauren, on VCH Hackney's behalf, was awarded the Mayor's Civic Award this year. And it's been lovely to actually hear from people how much that has mattered to them. Sometimes you can forget just saying thank you in a really structured and powerful way on behalf of the borough can make a difference to how contributions are viewed. But I'll hand over to Lauren and Claire. Thanks, Lauren.
Hi, I'm Claire and I'm the volunteer. I'm the Community Development Manager at Volunteer Centre Hackney, and I'm just going to talk about some of the work we're doing. If I miss anything, I'm sure Lauren will fill you in after me. So at VCH, at Volunteer Centre Hackney, we run quite a few programmes that are completely person-led, and they're community engagement work. We have the Community Champions programme. We also have a peer research programme that is happening right now. I'm the programme manager for two other programmes, which is the Our Place project and the Together Better project. They're all based in Hackney. The programmes that what happens and how we work with these programmes are, where it's a completely project-based asset development programme. We support people in the community to empower them to make positive changes in the community to how they see fit. This is a person-led approach, and we work with individual people about their own projects to set up their own activities, what they feel benefit their community. So it's what they say, not what we feel needs to happen. The Together Better programme is run in the same way. It's the same person-led approach. However, it's based in GP surgeries across Hackney, and the people we support are referred to us from the GP, social prescribers, and health and wellbeing practitioners. Our aim is to engage and support them into community activities that will benefit them and hopefully their health and wellbeing in the long term. I am a person that's lived in Hackney and worked here my whole life, so I completely agree with the approach. No one is better at saying what they need in their community than the people that actually live there themselves. Like I said, VCH, all the projects that we lead are community-led, and they are completely a centred approach for each individual person. We try really hard to support people and work with them, to get to know them, build relationships with them, so we can really understand the challenges that they face in their day-to-day lives. In that way, it enables us to support them better in making things happen in their community. Some of the projects that are happening right now with the Our Place project are, there's a community food pantry, there's a children's toys and clothing bank, there's community nature walks. We have a donated free IT equipment project that happens to families in need. We also have mindfulness sessions, Tai Chi, 5 walking groups, arts and crafts sessions. All the projects that happen with Our Place Together Better are run by community members for the community, and they're all free, so everybody's welcome in these activities. We all try to spend our time supporting them to bring their ideas to life and help them to address any barriers or challenges that they face them to achieve this. And there's lots of ways that we do this. We spend a lot of time doing one-to-one conversations with people. I think it always starts with a cup of tea and a chat, and to find out what's going on in people's lives. Lots of people feel that they lack the skills to do certain things in life, and we're just there to hopefully help them build their confidence through the conversations and the relationships we build with them. We try to create an environment of support or find training opportunities or run training opportunities to encourage them to benefit their projects and their activities and make them feel much more confident about the work they are doing. Where am I now? I've got some notes, sorry, I'm a bit behind. We help them network in the community. So if someone has an idea about an activity they want to do and they don't really know where to start, we will encourage them to network and meet other people in the community, like-minded people that can help them with their projects. This is not a quick fix, one-size-fits-all type of activity or type of working. It is really person-led, so it's an individual with the plan to work with everybody individually about how they feel and what they want to see happen in their community. We can spend months working with one person before they are ready to commit to doing something and offering one of their skills in the community. But it does work really well. I have been doing some writing for a report today, and just a little bit of data that came up was in the past 18 months, the projects in just the Our Place project alone has supported over 3,000 people in the past 18 months. So it does work, it does support people, and most of these people that we are supporting are people that usually would not engage in statutory services on a day-to-day basis. Lauren, what have I missed?
I think you've pretty much covered it. Is maybe just some of the kind of the other impacts that the projects have is that it really brings people together who wouldn't otherwise meet. And of course, a lot of people that we support and work with, as you've said already, have very little confidence and very complex lives. But it does bring in people who are confident, and they then attend some of these events that residents are running, and then they get confident to go off and do their projects as well. So we've seen relationships form between people continuously, a lot of peer support, particularly around parents, and the support. Like, we've got an after school club that's been led by a parent for at least 2 to 3 years, and all the connections that form out of that. It's all just, they're amazing to see. Yeah, I think that's it. Does John, do you want to come in at any point?
I'll talk about it in my presentation, and I'll say why I invited you along here today. I'm more interested to see any questions from the rest of the board.
Thanks, John, Claire and Lauren. It was really good to hear from you, and especially that perspective of linking that frontline community experience that Claire said, but also writing it up and making sure that we can articulate why it makes that difference, I think is really, really important. I did want to just use Chair's sort of prerogative and ask a question. You've got the entire, or almost the entire, health and wellbeing kind of commissioning, direct delivery and funding kind of stakeholders in this meeting. We all pay. Sometimes it feels like we pay a lip service to kind of community and prevention. I think what the pandemic has showed that it was more than that we built quite a lot here in Hackney. But what lessons would you have for us as we're thinking about recovery and rebuilding, and what a new normal looks like that hopefully embeds some of this experience? We keep saying we will, and you keep powerfully telling us why that's so important. But my question would just be, land with us why we should make what we have been doing the kind of default for how we support our fellow residents of Hackney.
Okay, well, I'll start, and then Claire can always chip in. So I just think that these projects are real examples of real resident engagement and resident involvement, that it brings people out the woodwork, it supports them long term, it helps people to really identify, to support them to come up with their own solutions to issues that they themselves identify. And so much of that result of that is that it's preventative as well as remedial, because it's led by people themselves, and that real resident engagement and prevention work takes a lot of work. It takes a lot of one-to-one support and time, and if you really want diverse engagement and diverse involvement, you have to put that resource in, and it takes time. It takes staff time. So for these projects that we have one member of staff who works 3 days a week, but they can cover 30, 40 people, but it still needs that person, the people who are confident, the people who feel very happy to go and engage with services and link with people and go out and do stuff. They don't necessarily need that work. But to really get diverse involvement, you need the resource invested in it.
Thanks, Lauren. Claire?
I guess I would just add that, this type of work is really going to the people, and we spend a lot of time waiting for people to come and tell us what they need in the services in Hackney. But these projects are in the community. We are in their homes, on their estates, in their GP surgeries, and we are going to them to really find out what's happening in their community and help them try and address the problems that they have. And a lot of the time, these people, they really wouldn't engage in statutory services in the first place. They don't feel the confidence to say how they feel or be heard sometimes. And we are kind of the stepping stone for them to do that.
And I'd say, sorry, that a lot of residents have really supported each other to engage with services where they wouldn't have otherwise done that, which includes domestic violence services, it includes housing support, mental health support. You know, they themselves have set up mental health peer support groups, walking groups. You know, we've had people, you know, want to say, I don't want to be in my wheelchair anymore because I want to get out and walk just like everybody else does. I mean, that's, you know, that's simplifying a much wider issue in much wider, obviously complex issues, but that's just an anecdotal point of where we've seen like kind of real impact from these groups. And I think it's the fact that they see their peers, they see other people developing and progressing, that they then feel they can too.
Thanks, Lauren and Claire. I think that was a really powerful response about why it makes such a difference. Any other questions or comments? And I know, John, you also want to sort of frame this, so I'll leave some time for that. Francis. So you're on mute, Francis.
Yeah, the work you're doing sounds absolutely fantastic, Lauren. But one of the enduring problems in the voluntary sector is short-term funding and having to scrabble around for applying for grants all the time. I'm just wondering if you have a sustainable financial base that makes it confident that you can carry on doing the fantastic work that you're doing.
I mean, I'm glad that you raised that, because of course it does continuously need ongoing investment. So thanks for raising it. I mean, the report Claire's been writing is to the lottery to try and get, you know, another lot of funding, but even if we get it, it's been cut in half. So yeah, we'll have to apply for other grants to try and maintain that. I mean, you know, the stuff that we talk about in terms of sustainability is just building up people's skills, the connections they make, you know, that's all longer lasting that you can't really quantify. But to be able to keep expanding it and to keep on working with new people, yeah, we're still going to need more funding.
Thank you.
That's right. Just, Francis, just for the viewers at home, so to speak, could you just say who you are?
Oh, sorry. I'm a volunteer at HCVS, and I'm chair of a small charity called the Sharp End. Oh,
fantastic. Well, I do love Sharp End, but haven't yet visited, so it's really good to see you here, and hope that the work that's happening around the Murray Lloyd Centre will bring to life more of those collaborations. So thank you for being here. I just, on that final sort of point about funding, Lauren, would it be useful to have sort of broader range of sort of support for that funding bid? There's obviously the opportunity to sort of write letters in support from us as a partnership, and I can see Councillor Kennedy nodding, so really happy to sort of do that and maybe bring to life why it's so important to the council as well as to the borough and organisations. Would that you please do use this however you need to, even if it's a short testimony. Councillor Fajana Thomas, question. And welcome Rosemary and Dr. Ricketts, I should have said.
Thanks very much, Chair. Lauren, Claire, thanks for your work. It was good to hear what you are doing in the community. My question is just a follow-up to the funding question in terms of being able to sustain what you are doing at the moment. When you are engaging in the community, one of the other things is the empowerment that comes with engagement, so that people you are engaging at this point, they are empowered to actually go into the community themselves and support other people. I'm not too sure how you are looking at that, if we're already doing that at the moment. Thanks.
So yes, we definitely are doing that. Part of the package is now turned into, we are supporting projects to do their own funding for their own projects, and they're becoming CICs all on their own and starting organisations on their own through us. So yes, we spend a lot of time funding for this project to continue, but now we're now supporting people to do exactly the same, because they've grown so big in their skills, their confidence, their groups of people in the community that are volunteering their time and help, and they are I think that is the sustainability part of this project, is these small community groups are growing into organisations of their own in the community. So yes, I guess it is sustainable, but again, their work, the same as ours, always relies on funding.
Thank you, Claire. Any other questions or comments? I'm looking around the physical room, online. So I know the next item talks it leads quite neatly from this in terms of the community engagement and Healthwatch. But John or Malcolm, did you want to sort of bookend this discussion and what we've heard from Claire and Lauren at all? And I think there's just a lot of shared agreement. I know that doesn't necessarily always lead to funding, Lauren and Claire, but I think there is a real agreement in Hackney about the importance of this. And I think I've said at Health and Wellbeing Board before I became chair and the ICB that unless we have a funded layer of voluntary sector organisations, large and small, any hope of prevention, social prescribing, the work that we see held together by things like the Wick Award or Hackney Connect, it all falls away. And they're expecting organisations to be able to take people and support people in the community without the resources that necessarily follows them in our current system. So, I'm a huge advocate for where we go next on this. I know there've been some really detailed discussions across the local voluntary sector, some held by obviously HCVS, some peer-to-peer, between some of the organisations like Old School Rooms, Shoreditch Trust, Boiler House, Common Rooms, VCH Hackney and others. So I think there's a lot of how they want to shape the borough. But John and Malcolm, did you want to come in at this point? If not, I'll hand back to Lauren and Claire and then we'll move on to the next item afterwards.
Just very briefly, I mean, the reason why I wanted Claire and Lauren to come along and speak today was really because I think it's really important that we do invest in kind of people who feel far away from institutions and from their community. And this is what's so powerful, I think, about this project and the other project they run. It's about how you build people up and support those people, and actually empower those people to actually kind of develop themselves and develop their own communities. I think that's one of the key things that I think the Health and Wellbeing Board wants to achieve. And so I think it's really important that that these sort of projects are supported, but also we recognise how they reach into those parts of the borough that are so far away from everything. So I think it's I very much welcome the work they do, and I'll fold it into, as you pointed out, neatly into what I'm going to speak to in a few minutes.
Thanks, John. Any final remarks or comments, Lauren or Claire?
Just will be chasing you up for that letter of recommendation.
Excellent. Well, if it was only just as easy as that, sadly we know it isn't, but we have had some notable successes recently and very happy to be a part of that and help bring it alive, because I think, when we do talk at a London-wide level, bringing it alive in our communities and in our boroughs is really, really important. And I know it's something that we all take back to Nell as well. All of that reorganisation within the health system, but the strength of the Hackney system has been that work across the CCG with GPs in general practice, with voluntary sector organisations, and we want to make sure that that continues and we can invest and build on it. Right, thank you so much. Fantastic, thanks Siobhan, I really appreciate that as well. So you've got some good leads in terms of additional support in the short term, and I think it's been really timely to have you come this afternoon, and as John said, it will neatly fold into the next item. Lauren, did you have any one last comment? I couldn't tell from your face.
No, fine, just longer term funding consideration would also be great. Thank you so much for the support for the application.
Right, thank you. So I'll bring that item to a close and move on to Healthwatch Community Engagement Plan. It comes out of the work that we did at the Members Development Workshops previously, and we're being asked as a board to comment and discuss on the engagement proposal, to comment on both the proposal, but also the common standards that I think Healthwatch Hackney and Volunteer Centre Hackney have put together, and also consider next steps for progressing strong community involvement within the board's work more broadly. So I will hand over to John and Malcolm, I presume.
Mainly me, I think, at the moment. So I'll just present the slide. And I'm new at doing this, so it is, see if I get this right. Okay, okay, there's the slide. So, okay, so I took kind of presenter's privilege and changed the name of this from strong community engagement to strong community involvement, because I think it needs to be stronger. We need to be kind of being more ambitious in terms of kind of getting the community involved, and that's partly why I wanted Volunteer Centre Hackney to come along and talk about their work, because I think it's the issues that we need to be really kind of aware of and be honest about some of the challenges that we face. So and I think involvement is the way to go. So to give a context, as the Mayor just mentioned, this really comes out of the development workshop that happened earlier this year, about creating how the Health and Wellbeing Board wanted to develop its remit and its vision and approach. And it was developed, as you can see, four priorities out of that, one being strong community engagement. I'm not going to read out the others, you can see what they are there. I think one of the key issues for me, and just a note that there's two actions came out of that meeting.
Sorry, John, to interrupt. You're not on slide view, so you're not going through the slides. It is showing to us, but it's not moving down. So I don't know if you can go to present.
Right. Okay.
Certainly not from what I can see. Is it showing up there? No.
It's not showing up there. Okay, so I'm going to stop everything. Right. Okay. Right. How do I get out of that? Okay, escape. Well, let's see. Sorry about that. I'll try again. Okay. Is it my entire screen? Okay, this should hopefully work. Can you see that now?
What I think I'm going to have to urge colleagues to do in the chamber is that they log into the virtual version of the meeting, turn the microphones off. They'll be able to see the presentation. I think the presentation will be live streaming, so residents at home watching it and colleagues that are watching it virtually. I know that brings with it its own technological challenges, but John, it's now displaying perfectly, and I think it will move on. But if we just allow colleagues in the chamber to catch up or share devices, but obviously keeping a degree of social distancing.
Right. Okay. So
crack on.
Okay. So on the context page again, just to kind of say there are actions to be done as well in terms of the community engagement. I'm going to be in contact with Dr. Sandra Husbands and Chris Lovett about meeting up about the initial planning discussion about this work. And there's also work to be done between ourselves, Healthwatch, City of London, and People and Place Group, coordinated plan. I think, as you know, the People and Place Group is putting itself in place at the moment, and so I'm hoping later in this year we'll be able to take that forward. I think the key thing here for me, and one of the things that really kind of excited me about the development process, was that there was a question about, does the Health and Wellbeing Board extend democracy? I thought that's a really important question, and probably the most important question it could ask, because I think one of the things I think we need to be thinking about is really about, if we really are going to make sure that people kind of feel really involved, that's about a democratic extension of the work of the council and how democracy works in this borough. So I think that's really the exciting part of this, and that's why we should be ambitious about this piece of work as well. The next slide. So what are the challenges? I thought kind of reflect on this. I think there's a distrust in institutions at the moment that we have to be realistic about. Many people feel that they're not listened to, and that things are far away for them. They don't think anything changes; it just gets worse. So that's kind of one of the big issues, I think, and they're not interested in me. And again, it's kind of, that's why I kind of thought hearing about the Our Place project was interesting, because it's kind of, there people sound like they're feeling like people are interested in them, and I think that's really important. I think just funding. I know we've just been talking about that. Austerity continues and is likely to intensify, and I think it's kind of the mood music from central government isn't great. I think the local authorities continue to struggle to have the funding that they need. We hear today about the NHS requesting £10 billion to just manage what they have at the moment. The over 60s might be losing their prescriptions. The £20 uplift for universal credit is going. I can go on, which is kind of so, but it's to really recognise that this is one of the major challenges we see. It's also about the world we live in. The pandemic is reshaping us. As the mayor said, what is the new normal? Do we have the words on site? Do we even understand this yet? It's a major change the way we may be living. I put the climate emergency in here because I wasn't quite sure about this. I wasn't quite sure, do I put this in or not? And the reason I put it in is because Hackney's a young borough, and young people are going to be facing the climate emergency. It's going to be, changing our lives. I'm hoping that, action will be taken, that, we won't be as bad as some of the predictions from the IPCC, the International Panel on Climate Change is suggesting. But I mean, I think it's really important that we kind of hold that there and recognise that that's an issue for us. And finally, it's a point about inequality. And so this is from Danny Doring, who's a kind of critical geographer rather. And I mean, I hadn't realised this until I kind of read this from a piece of research that he's done. It's in the 70s, the UK was second in Europe in terms of equality. We're now at the bottom. That's a big drop. So it's indicative of the challenge that we face at the moment. So I think those contexts are important for us to appreciate and hold as well. On to the next page. So what might strong community involvement and influence look like? It's this, for me, this is it's a community process, and it's about building trust over time. And again, that's why I wanted our place to be talked about, because it's kind of, that's the sort of thing that I'm thinking about in terms of when I'm talking about this kind of how you build these things up, and you build up, and it kind of flowers in a sense, because that's what we heard, sort of thing, people who feel far away come together, they begin to feel confident in themselves, and they start building something. And that takes time, and it requires trust as well. I think it's important that we're honest about the challenges. I think, it's the tendency, and I'm probably one of these people who kind of, keep trying to manage people's expectations. I think we need to be stopping doing that, frankly, because I think it's kind of, people kind of see through it, and it's a way that kind of institutions can lose people's trust. I think we just need to be honest about the challenges and work with people and involve people in resolving those challenges. So in terms of kind of what this might look like, I think it's about sharing power. So enabling those without the power to gain power. And again, I think the Our Place project kind of talks about that. It's about kind of giving people power. But I think it's also those with power have to ensure their approach is open, accountable, and transparent. I think that's really a key sort of thing to do. Again, it's about building trust, but it's also kind of, sharing the issues as well, and sharing how the solutions to those issues as well. It's really important, I think, that we collaborate with those who have little or no power, because that's the way we bring the communities together and we build the community as well. So very much it's working together, co-production, which is a bit of a cliche word, but I think it's kind of, it needs to be kind of fully implemented with resident involvement. It's about really about how we do share power. And we're currently updating the co-production charter to be signed off again by the Integrated Care and Partnership Board, hopefully next week. So what should people expect from us? So one of the things that we've been working and this is in a draft at the moment, is these community development standards. And I've been really grateful for the help that Volunteer Centre Hackney have been doing this work with us. We know there's a lot of change happening in Hackney and health and care services, and we know that these services want to be close to the residents. But we also need to making sure, and again, I think this is where the issues around the population hub work is kind of really important as well, and that can actually influence these services as well. So these services are really reflective of the needs of those people in those particular neighbourhoods. Again, this was kind of developed for the neighbourhoods, but I think has wider resonance as well. It's really about making sure that residents can influence change, and shows that the services are really listening to people as well. So, and I won't go into too much detail of these because this is quite dense, and I'm kind of conscious of time. Really about well, we did a lot of work on these. These were very jargon driven at the beginning, and we spent a lot of time trying to make sure that they aren't jargon driven and they're understandable to people. I mean, it'd be useful to know if people think we've achieved it or not, but we are still testing them and finalising them. So I think particularly as mentioned, it's the co-production, working together. That's a key piece of work that we want to make sure that the people we involve in this work feel like that they are being worked with, as opposed to worked on or made to do things. We need to be recognised that there's a social model here that's important. I think there's really a danger always that, and again, I think I can slip into this, is that we start saying people are vulnerable or they're defined by their conditions. I think that's very wrong. We're all essentially the same. We're all we're social beings, although maybe our conditions and our experiences are different. We need to recognise that the way that we exist in this world is in a social way, and that we share things as well, and we have common needs, and we should be working together to make sure that we all go together, forward together. It's also about diversity and inclusion, and again, this is really about making sure that I think one of the great things about Hackney is that it is a proudly diverse borough. I think it's drawn me back many years now, sort of thing. I've worked here in the 90s and I'm back here again, and it's partly because I find this one of the most exciting things about the borough. So I think it gives it great potential. I think it's extraordinary kind of the growth and what we could see if we get people really properly involved. I think it can be extraordinary, and we can demonstrate to others it could be an extraordinary thing as well. In terms of kind of community action and empowerment through resident skills, again, this is really kind of emphasising the need to recognise that to support people, we need to recognise that people need to have time to develop skills. And again, the reason why I wanted our place presented earlier in the community voice session was really to kind of emphasise the need to where you actually develop people's skills over time and build people up, and allow them to be properly involved in the work that they're doing. And finally, it's about tackling inequality. I'm not quite sure the words tackling inequality is quite right, because don't think it's quite catches what we're trying to do exactly. But I think it's really about making sure that the residents are a key part about the way we deal with the inequalities that were kind of so brutally exposed, but we're already there in the pandemic. And I think it's really important that we kind of pull that together and kind of make sure that we're doing this all together, and it's not us just trying to solve it for other people, but everybody's trying to do it all together. So in terms of kind of suggestion model, and we talked about funding before, these things need funding if they're going to work. There's two prongs here, a people-led prong and a voluntary sector led prong as well. In terms of the people-led prong, it's kind of I think ourselves and Volunteer Centre are doing some lead agency work on this, and I think it's kind of there are established groups that we currently run from our board to the public representatives in integrated commissioning, to the community voice steering group and other volunteers and the residents' neighbourhood. And we've heard from the Volunteer Centre Hackney about our place better together. And also, I think, not mentioned, but the community champions. I think this has been such an extraordinary initiative, and I think a really useful one. And I'm concerned it's going to be a disappearing resource. I think I know the community champions are about kind of putting out information at the moment, but the links they have with the community means that they can also bring things back to us as well. So I think we need to be thinking about how we can sustain such work, because I think it's kind of that way of working with the community. I think is really important. So I think it's in terms of kind of what we want to do. We want to make sure that residents can explore in this prong the priorities that their health wellbeing board will have, and that they can feed back their solutions to us. Again, this will take some time, because I think it's about, and again, this is what they're emphasising in the community voice session, it's about that, giving that support to people so they can do this piece of work with us. I think it's just going out there and kind of saying, hey, what you think about this isn't going to work. It's about finding out how they can actually kind of be properly involved and feel like that they're being involved and feel like they're being listened to and feel like they've got something out of it as well. This feedback will be then taken back to the Health and Wellbeing Board and sees what's delivered by them. And then it's important that any process there's feedback to the residents. I think one of the worst things you can do is not tell the residents what you're going to do with what they've told you. And it's also important that we hear from the residents about whether it worked for them or didn't work for them. Because if they're disempowered by the experience, then we need to figure that one out. And again, it's all about reviewing this and influencing how we can be improve and evolve.
John, how many more slides have you got? I'm just conscious of sort of time and debate.
Yeah, I've got about I can whiz through the next about three, and I'll be finished it. So I'll get through this.
So maximum 2 more minutes, if that's okay. Even if you come back to them in the debate.
Yeah, that's fine. So the VCS model is similar, and it's kind of this is based on work that Malcolm and Jake Ferguson were doing with the Inequalities group, and that's where the people-led stuff came from as well. Again, it's about making sure that the VCS have incredible good links into the community as well, and they can articulate those links and bring them together, diverse groups, people together in focus groups to actually kind of help the board work out again its priorities, and again feedback to the board as well, and again review it. So similar to the kind of what I was just saying, but again it's kind of just saying that the voluntary sector had their own groups, and I think they're really useful and a key part of this piece of work. We have various things in place to help us. That's a list of them. You have them in your papers. I'm not going to go through them. I'm just going to mention the VCS Assembly, which I think is a very powerful tool that's been really well developed. But it's also the established working relationships that we have across the council, health, the voluntary sector and trade unions. I think that's really important, and as well as the integrated care system and the various other things I mentioned. And these are the questions that's been asked, which the Mayor mentioned earlier. I'll stop sharing now.
Thanks, John. Did you want to add anything, Malcolm, quickly?
I think that what I would add is that, the question about power, I mean, it's a zero-sum game, and actually giving power and enabling people to have real power in the community is really sort of fundamental. And I think attached to that is the need for a good evidence base, because we talk a lot about empowering people, but we do need solid evidence to show that what we're doing is changing people's lives, not just there is an element and a risk of patronizing people when we're talking about empowering them, and we've got to make sure it's genuine, and that power sharing really has an impact on people whose lives are often shattered, particularly this time as a result of COVID and unemployment and loss in their families. So I think it's a big job, but I think we have to be very committed to make sure that empowerment process is active and evidence-based.
Thank you, Malcolm. You referenced the slide. I can't see the slides in the public pack. I wonder if we can make sure in the minutes that the slides get published, or a version of them, because I think it's a really good reference point, especially to people that may be watching us or hear about this debate and discussion. It feels like you've sort of written the next sort of corporate plan or mayoral manifesto for us, John, with a lot of what you've said there. So do we have any sort of questions or comments from partners, or a sort of response from the council? I can see Dr. Husbands is preparing to speak, I hope. I'm just preparing for a sip of water. Apologies for that. Because I think there's something really powerful here. But it's how do we then sort of make it happen and embed it in practice? And I'm just going to take Councillor Kennedy, and then I'll take you, Francis. Councillor Kennedy.
Thank you. Yes, so going to the, I realise some people can't see the slides, but we've got the questions at the end. What do we think of the common standards? They're absolutely great. As the Mayor has just said, virtually helping to write his possible next manifesto. Do I support the model? I think I want to understand practically what it adds, and I think that links into that final question: what's the potential risks of the approach? You mentioned it in the paper, John. I think the risk is that you duplicate what's happening already, or you confuse some organisations' work that they're already doing in terms of co-production and in terms of talking to, for example, their patients or their service users. So I think I'd like to understand, practically speaking, how is that model going to work? I mean, is it going to be going to those existing groups and specifically asking questions about certain services that don't have questions asked about them, working with those services? Is it going to be a reciprocal for unsolicited replies, or both? Or I feel we need some sort of practical example of how it would work in a restricted situation. See what I mean?
Yeah. Thanks, Kennedy. I'm going to take the other two contributions and then come back to John, if that's okay. Francis and then Jackie.
A quick comment on community champions, which I think is a great model and has the potential to get deep inside communities. The only problem is that quite often community champions are developed on a project basis. And so people get all fired up and interested and skilled in being community champion, and then it just stops because the funding stops, and it's like, well, what was all that about? So it's important to have a really solid, sustainable, long-term strategy for community champions, I think, in order to make the best of them, and get to get the most out of them, really.
Thank you. Yeah, I'm going to go with Dr. Husbands and then Jackie, if that. I'm not sure they're in use. I think we're using the.
I'm just going to have to shout
there. Yeah.
Thanks, Meg Land. Just picking up on comments from Councillor Kennedy, as well as responding to the presentation. I think it would be helpful if we had a live example. I also think it's really the principles are things that would be applied to lots of different projects and programs, and that so a single specific example not necessarily give us the depth of understanding that we might need to be able to apply them across a range of circumstances. One of the things that struck me in the conversation, though, is that, and I'm pretty sure John doesn't mean this, but there seems to be a bit of an overlap in the way people, or the way it's presented around actual co-production, as in working with people to define what we want to work on, to come up with solutions together, and even as far as co-design, as well as having people from the community holding us to account for what we deliver, as opposed to simply asking people about it. So we're really much more talking about engagement, you know, at the more involved end, or consultation at the less involved end. And I think that, so I think I agree with the principles, but I think we need to remember when we're using them that it's not just about a different way of engaging with people, it's about a way of working with people. And I think that perhaps that could come through a little bit stronger, particularly if those people are used to working that way, because don't want us just develop a charter and people then about changing what we do, moving into a different way of working, which is all about power sharing, as has been said before. And then just to respond to Francis' point about community champions, we have got a long-term vision, although it hasn't yet really become realised into a strategy or just speak plan for working with community champions over the long term.
Thank you, Dr. Husbands. That's really, really helpful. And I think that shift as well from engagement to involvement, I think that John did reference and you picked up, I think it's really an important one. Jackie.
Good afternoon. Yes, good afternoon, everyone. I'm Jackie Burke. I'm the new Group Director for Children and Education. So it's a absolute pleasure to join this meeting this afternoon. So not quite sure if my thoughts are going to fit as the new girl, but I guess as a public servant, I find myself in difficult positions sometimes thinking I know best. So I really welcome the thinking behind this proposal. And I wondered how we might be able to connect this with some of the ambitions, some of the ideas that came from the Hackney Young Futures Commission, where there might be some real read across between what young people are saying, enables them to feel engaged and being masters of their own destiny and having a say and influence on the decision makers. So it's just posing a question and just thinking, what opportunities might we have to join the ambition up?
Okay. Okay. I'll answer those questions. Okay. So, Councillor Kennedy's question about essentially how it will work. As a practical example, I think this is something we just need to start finding some examples to actually start working through and actually kind of figuring this out in a way. I mean, we've been doing a lot of kind of consultation in the borough. We do a lot of engagement. I don't think we do that much co-production. I think it's something we need to be developing more of, and I think I mean, there's been examples certainly from Healthwatch Hackney in terms of our community voice project, where we've actually kind of, you know, where we go out. So, for example, you know, commissioners or providers of services come to us and say they want to understand what the public think of their services and how those services can be improved. What we then do is we then go out and find people to actually kind of who maybe have a condition or particular interest in a particular issue, and get them into a meeting with those commissioners and those providers and actually work out in that space how you kind of improve things. And from that, we kind of then, you know, kind of go away, articulate those views and see how they can influence the services and then feed that back. So that's kind of it's a very simple example, but I think that's the sort of thing that we need to be thinking about kind of developing. And there can be various ways we can be doing this as well. And I mean, and I think one of the things that I want to be cautious about is that the Health and Wellbeing Board wanted to be doing this. We've got also the Health Inequalities Group who also want to be influencing this. We also got Integrated Commissioning also wanting to be doing this. I think that needs to be joined up. So I kind of welcome Mark Ricketts' point about making sure that the People in Place group are involved in this as well, because I think it's kind of it's about being joined up about this, because I think we're all facing in the same direction, and we need to be making sure we kind of coordinate our resources, which are limited. So we need to be making sure that we're making the best of what we have here. So I think it's about kind of making sure that we kind of build through that process. And in terms of kind of the thinking which leads across to the Health Inequalities Group is, and I'm doing a similar sort of piece of work there as well at the moment, that I'll be presenting in later this month. It's about kind of, you know, I've been thinking about how to use the public reps within that process to actually kind of pull in information about change that they want to do. So how do we actually link them into the community? And so that's one of the pieces of work that we're trying to figure out at the moment, is about, and again, that's kind of the people-led approach, in the sense that, you know, that you've got these public reps in the integrated commissioning system at the moment, but are they just floating free individuals, or are they linked into their community? What we want to do is make sure they're linking into their community, picking up those ideas, taking them into the transformation boards, and actually using those to influence the way those boards develop those services. But it's also another way to use those public reps for those boards to then use those public reps to go into the community to find out what's important, and then work with the community and then bring those ideas back. So it's trying to become a kind of continuous process of flow. Does that kind of answer your question, Chris, or is that too a bit blurry?
No,
I'm more than happy to work on it more.
That's helpful, thank you. Especially your reference of People in Places group.
Okay, thank you. In terms of what Francis was saying, and at the point that Sandra also picked up on community champions, I very much agree. I think this is about kind of building up something that's been a really effective project and making sure it's sustained. I think yeah, to develop a group of people who are able to go into the community, who have that community's trust, and actually kind of sustain that trust, and then actually kind of, and then for them to start bringing the ideas back, I think be very powerful. I think it's something that I think it's kind of, for me, they're almost a form of advocacy going on there, sort of thing. They actually kind of will advocate for the community. They can actually kind of bring things back that we don't really understand, articulate those things as well. So I think if they can be sustainable, I think it's really important that we do sustain them. And I think it's also right that it's got to be a long-term vision. Just being project-based isn't the way to go. It's about how can it be a continuous process rather than just kind of time limited, because I think time limited needs to go. I think it's about how we can push continuous change. In terms of let's see, that's kind of, I'm just going to pick up, and I think Sandra's got a good stretch in terms of kind of saying that this involvement's got to be meaningful. It's got to actually really change the way we are working, and it's got to become a way of working as well. And I think that's one of the things that we need to be working out in the coming months, as I work with the Healthwatch City and with the People and Place group about what that actually means practically, what it will look like. Finally, on Jackie's point, and welcome. I think it's a really important thing. I think the Hackney Futures Commission has done amazing work. I think from Hackney's position, we want to do more work with them, and I know that's being facilitated at the moment through the council. And I do want to make, that's partly why I was making the point about the climate, because we're a young borough and it's going to affect young people, and I really think young people are kind of a key element of this piece of work. I want to get them more involved. There's been some great work with the System Influencers, a group of young people developed to be public reps within the integrated care, and I think that's going to be built upon. And I think I would be eager that the Hackney Futures Commission is involved in this work, but also kind of holds us to account and tells us how well is it working, because I think we need to be given that stretch.
Thanks, John. We've massively, because I'm in the chair and Dr. Ricketts isn't, overstretched our first two items in terms of time. I think that's partly because they are really substantive in the quality of debate. I am going to bring in Siobhan and Mark because they have a really important voice in this as well. If people can be brief and then go back to John, and then I just want to make sure we capture what, maybe John can help us at the end, where the action is, because you talked about onward work both in the presentation and here, and I'm making sure that we've captured that for the minute. So Siobhan had her hand up. Lauren, I don't know if you could put it in the chat. I'm just really conscious of time. Siobhan and then Mark.
Thank you very much. I just wanted to pick up on your point, really, John, about the two partnerships working together, really, the Health and Wellbeing Board and the Health and Care Partnership, because there is clearly a lot of synergy about the two agendas that we're both kind of pursuing, and your points I think are really well made about resource and capacity, and I think it would be really helpful if we did try to consolidate and work across our partnerships so that we can both get enable people to work in a way that's meaningful and that we can do, because in some ways people don't really mind who's talking to them as long as it's somebody that's talking to them. It doesn't really matter what partnership they're from necessarily. What we need to do is do the work and do it well, but also it does help spread the resource a bit further. And I think the points earlier about funding are really, really valid. And I think it is really important that we try to find a way to make community and voluntary sector involvement and engagement sustainable. And it's not satisfactory from a statutory sector point of view, constantly funding people on this sort of, recurrent sort of project-based cycle rather than being able to commit in the long term. So if we were able to get that as a benefit by working more in a more joined up way, I think that's also something that we should really explore.
Thanks, Siobhan. Mark.
John and colleagues, I really welcome the paper. And just in summary, the thing about not continuing to reinvent new things when we haven't got the things we have got working well enough, and just with that latter point in mind, so the People in Place group, as one of the co-chairs of the Integrated Care Partnership Board, I would see in the future that the People in Place group would come and we would say, how's it going? What have you been working on together? Where are you seeing your influence? How does it feel to you? And we are feeling our way here. I mean, it's not like we've landed something we've been doing for several years. This is new territory for many of us, and so therefore that if the response comes back from People in Place, well, actually we're struggling to get in there into the places we think we should be in, then the Integrated Partnership Board will be asking questions about why is that when we've all signed up to the commitment around co-production, for example. So I think the constant sort of challenge to make sure the work is real, in a way that Dr. Husband said, is that we are working together, is really welcome. And I think there will be ways, in many ways, we can continue to be challenged to get it right, or to make progress in improving what we do in this work.
Thanks, Mark.
Okay. Just a comment. I mean, I have to say, Siobhan, I am incredibly eager that we don't do silo working. Really, I mean, at the present, I feel split across three things: what the Health and Wellbeing Board are doing, what the Health Inequalities Group are doing, and what the Integrated Care is doing. And I want to stop that because it's kind of I'm just repeating myself in three different places. I think it's a really good opportunity as well to continue to build on the integrated way that people work together. One of the things I mentioned was the good relationships that we have in Hackney and also across into the city, that we need to just keep building upon and keep working to make sure it all works together. I know there's different places of emphasis for all those groups, and I know the Health Inequalities Group was really about influencing those two groups as well. And I think we should make sure that this is integrated into that process as well. Because and I think Mark's right about the People and Place group. I think that's a good group to give stretch to this as well, but also to get them really involved in this. And I think that's what I want to make sure is the next steps for me. In terms of the next steps that the Mayor asked me to kind of mention, I think it is about making sure those actions that I mentioned earlier on in the presentation are carried out. So I'll be writing to Sandra and Chris tomorrow about meeting up, about how we can plan this and take this forward. I think that's a really important discussion in terms of kind of just linking into what's happening in integrated care and the Health Inequalities Group. But I also think that needs to be now linking also into the city with the Healthwatch City of London, and also the People and Place group, which is, as Mark said, is still forming, but is formed as well, and to develop a coordinated plan, because I think that's the way we should be bringing it together, because essentially the Healthwatch is linking to the Health and Wellbeing Boards, and also into integrated care, and working with People and Place group just makes an obvious next step as well. So I think it's in terms of kind of the next steps, it's about us kind of talking to public health and taking this piece of work forward with them, but also working with our sister organisation in the city and the People and Place group to start developing a coordinated plan, and coming back to you about how this is all going to work together, and also taking on board Chris Kennedy's point about kind of saying what's it going to look like, what's it going to look like practically.
Thanks, John. I would love to bring Rosemary in, but we are probably approximately 40 minutes overrunning, and we're only on the second substantive item on the agenda, so I'm going to have to move on. But if Rosemary can connect with John and colleagues outside of the meeting and make sure that her voice is heard, and if there's an opportunity, Rosemary, to bring you in a later item where you can reference back, I will attempt to definitely do that, or like I suggested, Lauren, put it in the chat. I think that was a really good discussion. John, you've set out a really clear sense of direction forward, and I think there's a lot of support here. Moving on into the Health and All Policies Forward plan. The Health and Wellbeing Board's Health and All Policies Forward plan focuses on a different theme in each Health and Wellbeing Board, which has been part of our sort of work to refocus. I just want to make sure that the board looks at the forward plan, advises on any further thematic agenda items to be included in the forward plan related to the Health and All Policies meeting theme, and consider the Health and All Policies work conducted by the board to date and any process amendments, changes that could be refined either in the latter part of this year or the early part of next year's work. I think we've been really successful in kind of progressing this work, and so as co-chairs, I think just getting a sense of how that is working, how we're forward planning meetings, how we're involving different partners and parts of the council. I know I've also been really keen that this isn't just a work programme of the council in a health and all policies kind of framework, that we get, as we've had before, the voices of the health system and the voluntary sector. We've obviously had a really good sense of that in this meeting through the first previous items. But if the police want to bring their work around mental health or thematically that fits in with the board's work. I think there's, we're a little bit light on some of our broader parts of the system today, but it would be good in the same way that there are diverse voices obviously within the council from different parts of the system. I'm conscious of time. I hope colleagues have access to the report. Does anyone want to come in based on what I've said, or shape the discussion any further? Annie.
I'd like to see education down on the forward plan somewhere. I can see there's a couple of agendas that look a bit light, but we could talk about the contribution of schools out. And I think I'd also, in talking about the health and wellbeing strategy, we were just discussing those two themes about generally improving health and wellbeing and tackling inequalities. And I think it's really important that they are both approached and not just forward.
Thanks. Sorry, I was just scrolling forward. My remarks obviously around the police. There's quite a substantive item coming forward on violence reduction and ADA, I think, if I'm getting this correct. And we it's a basis to sort of look back and look forward. So, or is this just a look back, Peter, in the remarks? I'm just trying to. There's the forward plan. Sorry, I don't have access to the full plan. That's a good start. But I think we'll note we've got a sense of where we've been here really clearly. I think the aligning some of the contribution that education can make, I think is really, really important, and also bringing some of the school voices perhaps. So Sandra.
Thank you. I think the paper is a little confusing. So the embedded paper is not organised paper. And this one, the dates are a bit skewed, so I think it is actually just going forward in January 21. So these are the things that we kind of have penciled in for. Actually, no, you're right. It's looking back as well as food, isn't it? So we've got something penciled in for November and not much beyond that. And then I just wanted to make a couple of suggestions. And I welcome the suggestion from Annie about schools and education, their contribution to wellbeing, and also agree of the overriding objective of the health and wellbeing strategy being about both improving health and reducing health inequalities. But the suggestions I wanted to make were around climate change and thinking about the contributions of all of the partners to reducing use of fossil fuels, reducing carbon and other greenhouse gas emissions, and doing whatever it is to reduce climate change. That could be a useful conversation to have here. And then another one that I was thinking about, not just related to the ADA and violence reduction work, was about safe communities and what's our collective contribution to helping people to feel safe.
Thanks, Sandra. I think I've pieced it together. The 10th of November is a forward look, and then it is January 2022 and the 23rd of March 2022. But we're also looking back at what we did a year ago when we had the discussion about parks of green space and child-friendly space. So I think there's an opportunity to hook in what we've just discussed into that forward look and the light agendas. I think it's just the dates that are slightly confusing, and take on board your points. I think it would be quite useful, I don't know if it's possible, on the 10th of November item to fold in, I know it's sort of held a little bit by the ICB work, but the new substance misuse service, and that was recommissioned obviously relatively recently with a different scope and focus. But I think it's really important if we're discussing substance misuse that we've got that voice within the ADA project or alongside it. I think it's going to be a big agenda, difficult to chair, Mark, but I know we've repeatedly gone back to what is the wider contribution around violence reduction and crime. And I think Sandra's points there are really valid. And then I think there is something around climate and climate resilience. It was referenced earlier about being a young borough in John's terms. We know that when it comes to climate events, the impact is on the most vulnerable, and that's old and young and our diverse communities. And I think at the NEL level, in one of their community engagement events, there was an early attempt to look at the sort of environmental impacts on health, be it air pollution, heat events, and things like that, and just connecting that all together. Clearly, there are elements of the Parks and Green Spaces strategy in terms of well-being around public space, but I defer to officers maybe away from the meeting to sort of feed in and plan a little bit about how some of the topics we've just raised would fit best in that work. But I think really valuable to do that scoping. Are there any other reference points or comments on our previous work schedule or the one that's set out here? It would strike me that the 27th of January could accommodate the climate discussion, and it would be good perhaps sort of 2 months outside a COP at the start of the new year to do that. Equally, there is something about a built and natural environment on 23rd of March. I wonder if we could pick one or other and then make the other one young people focused, perhaps. Any other questions or comments? If not, I'm going to win back some time. And please do feedback either to Peter or to Donna or colleagues about how they would like to shape this going forward. Thanks, everyone. Deanna, Public Health Intelligence Strategy and the JSNA process, over to you.
Thank you very much, Chair. Good evening, everybody. Firstly, two things. So first is I would need to leave after I present to collect a child. And the second thing is the action plan is not quite right about the agenda, about the item on the agenda. So I won't be presenting as much on the Joint Strategic Needs Assessment. This presentation will focus on the City and Hackney Public Health Intelligence Strategy. And I will be touching on the Joint Strategic Needs Assessment. And I would like to bring a detailed proposal to the next meeting if there is a slot in November, and if not, then maybe the following meeting.
Deanna, this 4 till 6 slot is, I think, now established for the board. I think if we can bring you forward, given what's happened today, and make sure that we do that earlier in the agenda, assuming that works for partners, let's do it.
Okay, thank you so much. Sorry, wrong screen. There you go. So the presentation today, I'm going to give you an overview of the role of the public health intelligence in providing insight and value to organizations and systems. I thought it would be good to set out the scene with that. And then the substantive bit of the presentation is going to be the outline of the City and Hackney Public Health Intelligence Strategy. I'm going to then demonstrate principles in the strategy to our COVID response work. And the second, so the first case study and the second case study is around the proposed changes to the Joint Strategic Needs Assessment. But like I say, it's going to be just very, very high level overview. And the detailed proposal, I'm still working on it. It's in development. You also have supplementary slides there outlining actions for each of the strategic objectives. So just so it doesn't sound too fuzzy, we do have concrete actions associated with each of the objectives, and these are in the supplementary slides. I will not be presenting them. So what is public health intelligence? What does it do? The World Health Organization defines public health intelligence as the process of moving from data through knowledge synthesis to action with a specific aim of early detection for effective response. And it's quite an important and different definition from what most of the people might imagine public health intelligence does. So it is not simply data handling. It is taking that data, and synthesizing it with all of the information that we've got in place in order to inform action and effective response. So in essence, public health intelligence provides information and insight, which is essential both to identifying issues that have a negative effect on people's health and for planning to deal with those issues. And as such, our function is central to improving health, well-being, and making effective decisions on allocation of resources to a wide range of public sector programs. My team's work is also system-wide because determinants of health span from wider determinants like income, education, housing, to behavioral, to community and environment that we live in, access to healthcare services. So we do really work across system and not just within the public health team. So I've had actually, and I was happy to hear a lot of familiar themes from the previous presentations. So people talked about needing for evidence base, being very specific about insight into specific communities rather than generalizing, being accountable for the insight that we collect from our residents, and evidencing that we have done something with it. It is really what this presentation will do is echo quite a lot of the same. So within the public health intelligence team, one of our key goals is to generate actionable insight that will in turn provide value. On the left of the slide, you can see a data journey, and it just describes what happens with the data. Firstly, you've got this unstructured data, might be just a big data set. Then there is an information where you make it pretty, you make a table or a chart, and you might describe what people see on the chart, and that's information. Insight is where you try and give a context to what people are seeing. So synthesizing evidence, trying to make sense of it. And then action is based on the insight and the recommendations following from the insight. What action do we take? And what value can we generate? Can we evidence it? So historically, the bulk of my team's work was dedicated to the first two steps. So that's data and information. And the new strategy will shift the focus of the team's work towards the insight generation and providing, enabling action and providing value. So we do recognize that value is understood differently by different stakeholders, and the FIT, so the Public Health Intelligence Team for short, FIT, ambition is to support the broader Hackney Council vision, which is to make Hackney a place for everyone, whatever their background, where people have a chance to lead healthy, successful lives, where people are proud of, with excellent services, strong communities, a place that celebrates diversity, and people are feeling valued, included, and involved. So in a nutshell, our work will always strive to adopt the principles of inclusion, equity, and ethics in the context of the public health intelligence. Why we needed this strategy? It is firstly really because we didn't have one, and it made it quite difficult to plan work and also understand and evidence the impact of the team's work. But also we have gone through a restructure in 2019-20, during which it was recognized that public health intel needs to play a more strategic role. And at the same time, there were some developments that signal stronger focus on collaborative work, and that includes the rollout of the integrated care systems, as well as the most recent merger of the 7 North East London clinical commissioning groups. The intelligence strategy came about because of these things, and also after the pandemic hit us, we realized that we just cannot simply go on and work in the ways that we used to. We need to be more agile and robust, and we need to adapt to the times. Our project completion times have reduced significantly. We needed to up our skills. We need to ensure we have access to essential data, and importantly, that we collaborate on the insight that we provide and ensure that we align things wherever is possible. So moving on to intelligence strategy itself, it has 4 main aims, and they are, the acronym I use for it is READY, so resourced, empowering, diligent, and insightful. The public health intelligence team would like, to given all of the changes and challenges that we had, we really would like to turn them into opportunities, reflect on it, and given what we've learned during the pandemic and before that, just building on our strengths, help and fulfill these aims through the objectives that are associated with each one of them. So, for instance, within securing adequate resources to the team, so being resourced, the objectives that we would like to fulfill for in order to achieve this aim is to build strong relationships with analytical teams across the system, to upskill staff and increase efficiency and capability, secure necessary analytical tools, and ensure access to essential data. All of these are quite important, and they help to reduce the duplication of effort, ensure that there is exchange of knowledge and skill, ensure that there is enough motivation within the team and that they have space and time to develop and progress and to dedicate that time to generating insight rather than that what we've done in the past, having a chunk of our time doing a lot of manual processing. And the last objective around essential data also includes rethinking what constitutes essential. It might be that in light of all of the thinking that we're doing collectively as an organization, especially around equity of access and bringing different insights into the mix, we need to extend that understanding about essentiality. Maybe we need to start collecting a bit more detailed data around different communities within the borough so that it is quite specific, the type of insight that we produce. We also aim to empower stakeholders to handle and interpret information, and that's a win-win really, because not only does it build confidence for people to be able to take information, understand information, be able to interpret it for themselves, understand where maybe there is a spin on data, but also it is good for the team because that means if people are quite independent and enabled to do that, interpreting themselves, our ad hoc requests would reduce significantly. And again, we've just noticed it through our COVID work and all of the outputs that we've produced during then, that it is quite possible to achieve. And it's kind of this strategy informed COVID work, but also some of our COVID work really did inform some of the objectives within the strategy with an aim to roll them out to all of our other work areas. So the objectives here are to make intelligence products more accessible by simplifying format and language, ensure that stakeholders who need access to information have it, build a comprehensive suite of internal dashboards covering all public health topics, and that's so that we stay in the know and we don't refresh every so many years, but we have constant flow of data and information, and we understand and are able to act on things if we notice that trends do go wrong, and as soon as we notice that. And also building public-facing dashboards, and in the same way that we've done for COVID, creating a repository with the key population statistics that people can use as the one source of truth. We also aim to establish robust information governance practices, and this is because most of our work relies on the residents and service users' trust in providing us with their personal data, and misuse of personal sensitive information can lead to serious reputational damage and high financial liability. So for the objectives, we will be reviewing existing data sharing agreements and assessing whether they support the needs. We'll review information governance practices and seek to identify opportunities for improvement. And we'll work with stakeholders across the system to ensure access to relevant data. And that's, again, on the back of the thinking that for a lot of our purposes, the data that we were receiving in the past might not really be quite fit for it, especially in an example of services. So sometimes a service provider would only provide us with data associated to their key performance indicators, but what we do really want to know is whether service is equitable, whether it's representative of the population that it's aiming to serve, And if not, what are the barriers and how we could act on them potentially. And lastly, we will aim to generate timely and actionable insight. And that is just as discussed previously, because our work is much more than data handling. We aim to generate that insight, and in order to achieve that and add value to our organization, we'll need to fulfill these objectives of foster collaboration and information exchange, aligning intelligence work with key strategies and policies, with research and commissioning, and establishing clear process for project initiation. So all these things, again, quite important, and it's been mentioned in the previous presentation how important it is for us to have good communication and aim not to duplicate between different forums and different groups. So collaborating, understanding what each one of us are doing, what different teams within the systems are doing, and how we can reduce that duplication and maximize on our skills and capabilities and our knowledge. And aligning also with...
Deanna, can I bring you to a close? Sorry, just for time. Are you able to sort of, I know there's the ask around the next stage of the process. Is that okay?
Yeah, shall I summarize? Or... Yeah. Okay, so for this section in summary, the objectives are interlinked, and where we fulfill one and it aids to in fulfilling other ones. Some of the top priorities I've listed there, and that's aligning work with strategic commissioning plans, fostering collaboration, utilizing networks and skills, ensuring good information governance practices, establishing effective communication, and securing resources. And I did want to mention that while this is a public health intelligence strategy, these are really quite common themes that I hear throughout, and when I talk to different teams and when I speak with colleagues both within Hackney Council and outside. So it could really be rolled out more broadly, and we do have a vacuum whereby we don't really have a council-wide insight and intelligence strategy or plan. And it has been highlighted several times during today's meeting that there is it's missing. The alignment of things sometimes is missing. So perhaps some of these principles could also be adopted more widely across council or across the system. That's my last point. And I don't know if I have time to go into any of this. Probably not, but you have the slides.
Well, the only way we could do that is if we pulled a later item on the agenda, I think. Just sort of looking forward, because there's still the health and wellbeing strategy update, phase 3 COVID and flu vaccinations, family hubs growing up well, all in 22 minutes, allegedly. I'm seeing that Jackie has helpfully perhaps put in the chat. So we might be able to do that in a quick way. But I think we might have to, if we're bringing you back, Deanna, at the next meeting, to sort of move that second half of it into that wider look, if that's possible, and also conscious of your own time as well with what you said when you started speaking. So could we sort of pause it, split it into two halves, and bring that second half back? Do anyone have any questions or comments, or did Sandra want to come in at the end there to sort of, Councillor Kennedy?
Very short one, Jeff saying it's a great piece of work, but it underlines how important effective data sharing between different organisations is.
Agreed. Any other questions or comments? I personally don't have access to the slides. I think it's just something wrong with how the access is in the background papers through the public portal. One thing I did want to pick up was the 2 engaging point, Deanna, which I think links into the work that we were talking about, the community voice. I think there's something about this intelligence asset being open, which is obviously a council value, and how the broader system can interact with it and draw down either some expertise or some data. One of the common things, I think, if we go back to sort of bidding for external funding and trying to justify an evidence base to do something, is making sure the sort of VCS, the broader system, can take what they need to then advocate around inequalities, diversity, public health intelligence, whatever it might be, to make the case about why Hackney needs this resource. And I think if we can construct something using this sort of methodology that allows not only the council and kind of commissioners to see that, but it's more widely available, that would be something that could be really useful across all of the themes of today's meeting, and also shift what we're going to be focused on. The last bit I was going to say is there are some parts of the country that clearly, after a period of reflection and looking at intelligence, decide that there's a couple of things they want to really shift. And I think for me, and I'm bound to say it as a politician to some extent, is picking some really clear public commitments around some of these indicators, some of this intelligence that we might want to move forward on, whatever that might be, and be known for it, and deploy the whole of our system resources towards it. I think we've done that in the past. I think we've got some very clear corporate priorities. But if we actually got down into the detail of some of our indicators, I think we would find some really rich things that we might want to collectively commit to, and that would be something that I would really value. That's enough for me though, Sandra.
I don't want to prolong the item. I think it's a good idea to bring Deanna back to the next meeting and have a longer discussion there, not only about the GSNA, but perhaps elaborate on this initial presentation of the health intelligence strategy, and how, as a board, we can help shape the strategy and also help in the implementation of it.
Yeah, I think so. And I think we just really welcome the resource that we're sort of building and developing in the focus in that spirit. And again, we've talked about community champions coming out of COVID. I know we're not making public policy by public dashboard, but there is something about a laser-like public focus and transparency around what is happening around an issue. And one of the groups in Hackney that have sometimes said, you don't publish your cancer rates every day, you don't publish your infant mortality every day, you don't publish other life outcomes every day, but actually why don't we? And why don't we have that focus? So I think, Francis, I'm sure that this is not just a discussion in the room. Deanna, could you bring down the slide just so I can see the grid view again? Francis.
Yeah, we've heard a lot about the importance of community information and experience in this meeting already today. How are you going to integrate, get hold of and integrate some of this kind of soft stuff, which historically public health has not done a lot of, it's fair to say, I think. You don't need to answer that question, I'm just raising it.
I think it's an important question, and I'm going to try and answer it at the next meeting within the GSNA redesign.
Okay.
Great. Sorry, Deanna, on so many fronts about what's just happened, but I think it was really important to more than whet our interest and really set out that earlier part of what we're doing. And I think that will neatly fold into the next meeting and coming back to this area again. And I think what Francis has said is really, really important. How do we marry the resident experience, insight, community voice with the hard data? And I think what I was reaching for, and I think Francis put better, is those two things should then come together, and we would find common cause about the things we want to focus on and respond to. So hopefully that is a good finishing off point for that item. And thank you again, Deanna, for this work and the work that you do on a daily basis. The next item is Sarah Bainbridge's work on the health and wellbeing strategy update. I'm told to warn you that you have 10 minutes to present and 15 minutes for discussion. But if you can do it quicker than that, that would be absolutely excellent. But I appreciate you've been squeezed.
No, absolutely. Thank you Chair, and hello everyone. My name is Sarah Bainbridge. I'm a public health registrar and I joined the team about 4 weeks ago. I've been supporting Donna Doherty-Kelly and others on the health and wellbeing strategy, which I understand has been a work in progress for some time. I've got a couple of slides just to share. I won't take too long on these because I think they're fairly straightforward. So the first thing just to show you is a timeline of where this process is at. So I understand that this has been a topic of conversation at previous Health and Wellbeing Board meetings. So this is in part an update as to where we're at the moment, and also to get a decision on a couple of things about how we progress this. So just as a brief reminder of where we are at in the process, July and August have been focused on a huge amount of engagement with residents and stakeholders. And I was really pleased that Lauren and Claire were speaking earlier, because we are using a group of peer researchers who are all coming from the volunteer centre to really engage with people and get their insights. So we've been using a multi-pronged approach to our engagement. So hopefully this isn't a surprise because you were aware of the progress previously, but we've been holding stakeholder workshops. We've got a survey that's live for residents and stakeholders. We've been doing some one-to-one meetings, and our peer researcher work has been progressing brilliantly thanks to Lauren and Claire and others in the team. I think there are over 30 peer researchers who've been trained, and they are approaching this at pace. So in the paper that was shared, we had over 60 interviews and surveys conducted by our peer researchers. That's now increased to over 160. So we're really on good progress to make sure we're hearing from as many people as possible. We're also getting live updates on what the insight is from those peer researcher interviews and our surveys. And I'm just conscious that we are, my slides might be on the wrong one. So I'm just on the methods of engagement slide at the moment, just so you can see that. And we are making sure that our what we're doing for the last 2 weeks of engagement is targeting that engagement with any parts of the community, with any particular groups of residents who we haven't necessarily heard from yet, by inviting people to one-to-one interviews, and also noticing where we need to perhaps extend our outreach. So we're hoping to make sure that we've got a really good coverage of people who live and work in the borough of Hackney. So our engagement is progressing, and what we're aiming to do over the next couple of weeks is finalise that. So you should be seeing our timeline again now. What we'll do at the end of September is bring together all of that insight that we've heard from those various streams of engagement. We'll analyse it, and then we're proposing a prioritisation workshop. And that will be for Health and Wellbeing Board members who can make it on the 1st of October. And that will be a chance to really get into the meat of the discussion so that we can hear all of that insight, look at themes that are coming up, and making sure that we can prioritise for the health and wellbeing strategy. Once we've done that insight, analysis and prioritisation, our intention as planned is to have a 12-week consultation in November. And then we're going to bring all of that for formal approval and adoption by the board in March. So that's where you can see the second orange rectangle saying that we'd like priorities to be approved then. I'd be very keen to hear from the board if anyone has any questions on this in terms of an update, but also to get a steer on any preferences for that prioritisation workshop that we're proposing. We can do a hybrid format or online, and also just to unpick and perhaps revisit at a later date the idea of having our formal adoption of the priorities in March, and then doing a later full multi-agency action plan and launch in the summer of next year. So just to finish my presentation and allow a bit of time for questions, this is just a reminder of our next steps. It's drafting the insight report from our engagement, The engagement is still open, so we've got another 2 weeks where we're engaging with people, prioritising right at the beginning of October, and then bringing a draft strategy to November's Health and Wellbeing Board meeting and going out to consultation for 12 weeks from November. I will stop sharing there, but if anyone has any questions or comments, then over to you.
Thanks, Sarah. That was really succinct and really clear, and thank you. The last bit from the chair would just be that 22nd of March date, and whether that falls within the pre-election, what we used to call PERDA, but we don't for obvious reasons. It could truncate what we can discuss and how we sort of deal with that sort of policy issue. So if we can, I'd be for moving it forward if it falls within the pre-election period. It might not, we may have already considered that, but just to double check. And then I think there is something about how it does interact with corporate plan refreshes and the political cycle, and making sure that if we're aiming for that summer moment, that we align it all, and we're clear that for the sort of next administration, whoever it leads, it's got this rich seam of policy focus within this strategy. And I've talked before about how partners sign up, how the council kind of adopts it, where we want to go, and how we're really clear in a public facing way that this is what we're going to do over the next period. I think that it feels like we align in quite a good way, but we just need to make sure that we do. Any other questions or comments? Dr. Ricketts and then Annie.
I was just going to make a comment about it's really welcome work and really exciting to see it progressing. It'd be very interesting to see how at a North East London integrated care system level, the partnership board element of that, which is as yet unformed, undefined even, and further government guidance is awaited. And then we are able to shape that as a system across North East London. How we then, we've got our plans and others will have theirs. And actually where the added value can be doing something close to that level, or actually, no, fine, we'll just get on with it. It needs to be done locally, get on with it locally. And I think getting that right will be a really interesting challenge going forwards, but potentially could be very helpful.
A really, really important point. And I know that they're sort of developing and workshopping that as well.
Yeah.
Annie and then Sandra, and then conscious of people remotely. Annie.
Thanks. Good to hear about the consultation and engagement. Could you just say how confident you are that will be sort of in proportion to the demographic of Hackney, that it will reach out to all ethnic groups, to all levels of income groups and sizes of families?
Yeah, I'm happy to come in on that now. So we've been, as I said, we've been working as we go along to understand the demographics of the people who've been taking part with our peer researchers, and also with the survey that's live for residents. So I know Lauren gave me a brilliant update before we started, saying that we're trying to make sure we go to events where we can bring the survey to them, so food banks and other community events where people are likely to be at. We're going to the Hackney Youth Parliament this evening to make sure that we can hear from different age groups. And I know that from having had a look at the people who've already taken part and responded, we're then targeting our last 2 weeks of engagement to make sure that, for instance, we might not have spoken to as many people who are families with children with learning disabilities. So on Thursday, I'm going to go along to speak to Hackney independent parents to make sure that we're targeting that. So we'll make sure that full demographic breakdown is available in the insight report, but we'll also do our best to make sure that it's as representative as possible, so that we're hearing from seldom heard communities and groups.
Thanks, Sandra.
Thank you. And just picking up on Dr. Ricketts' point about the North East London integrated care system strategy, which I know there's some discussion about how that might develop at the moment, and so that we can make sure that our health and wellbeing strategy is aligned where it makes sense in terms of things that, like thinking about medical institutions, for instance, there's benefit to doing it, so more people understanding. And then the other thing, as you said, we just said we'll just get on with it because these are what other priorities are. So we are taking an approach that's both very thorough focused. What do people here want to need? But then in terms of the actions that fall out of some of those might be over a wider field.
I think that all makes sense. Thanks for posting the link. Is that enough to be going on with, Sarah? As a step?
Yeah, I think as long as people are happy with the sort of progress we're making, and also happy with the approach and next steps in terms of prioritisation at the very beginning of October, and then bringing things to the November board for then that priorities being published and approved in the March meeting, then that's all good from my perspective.
I think we are. Lauren, there's a pensive look there. I'm not picking on you. I'm just looking at faces in the grid and making sure that I do include if you want to just say something.
Sorry, I think that's just my resting face. Well, I suppose I can just back up Sarah by saying, yeah, the volunteers themselves come from incredibly diverse backgrounds. We made a really big point of really trying to recruit people and really target them. So they have languages that cover Swahili, Urdu, Punjabi, Spanish, Polish, Turkish, and they're all linked in. There's different ones linked in with their mosques, synagogue, churches, doing their GP surgeries, and we're also getting volunteers to go to focus groups as well. So we got a member of staff at Anchor Hanover for older people living in care, and as I said, the food bank, and we're going to Round Chapel on Sunday, and we're doing several of these. So yeah, we are trying our best to make sure that they're as diverse as possible, but. Yeah.
That was absolutely brilliant. Thank you. Moving on to the next item then, and Graham, who's waited very patiently to update on our COVID and the flu programme. It's interesting. We did have a theme today. We just didn't know it, and it was community involvement. I think it's been pretty clear through every item, so we can mark our own homework on that. Graham.
Thank you, Chair. So I'm conscious of time. So if it's okay with people, I'm not going to go through the paper, but I'll just update on 4 areas. One being community engagement, the other on where we are at with children and young people, where we're at with 18 to 25, and then the booster programme. Is that okay, Chair?
That'd be brilliant. Thanks, Graham.
Okay, so I'll assume people have read the paper. So in terms of community engagement, there are a whole number of issues about why we've needed to undertake community engagement. If you look at the table of the different cohorts, we see a descending level of uptake as we move into younger and younger cohorts. And as we move into younger and younger cohorts, the perception of risk, I think, does definitely change. So that has definitely been a factor. You can clearly see a disparity between uptake across different ethnic groups, and that varies depending on the cohort. So as you get to younger cohorts, that's even more stark. So clearly ethnicity does play a role in people's perception and their confidence around vaccine, and therefore their uptake or access. And there'll be a whole host of reasons behind that. And then geography plays a part. So high areas of deprivation, local super output areas. So all of those contribute to why we would want to undertake community engagement. So we've had a process which takes us up to the end of September. And that process has been a grant funded process, managed through HCVS, supported by Lauren and VCH. To commission a range of community groups to basically work with their communities for a number of weeks. That has then led to a pop-up vaccination clinic, and that's delivered by Burke's health outreach team. And the community group works on the day of that vaccination clinic, and they give a steer towards the site, and then there's some follow-up. So we've had the table gives you a range of those pop-ups that have taken place. Those continue, and they will continue until the end of September. What we've agreed as a system is that we want to carry on that process until the end of March. So we've agreed across the CCG and Public Health that we will jointly commission this programme until the end of March. So, so I was just signing off some things with HCVS today. So we'll have another grant-funded process. HCVS will lead that. Hopefully that will go out to community and voluntary groups today or tomorrow. There'll be just a couple of things I just want to raise about that. So we'll continue with that in pre-engagement leading up to pop-up clinic. But what we also want to do is enable those groups to undertake on-street engagement, because we really need to maximise where we can throughput into our current services. So all our current services offer walk-in, and we really need to get that message across, really. So anybody can walk into any one of our services, whether it's the local vaccination site or any one of our pharmacies, and be vaccinated. So we really want to maximise that, really. And then the second thing is that we want at least a couple of those initiatives to be focused around 18 to 25, and I'll come back to that. So we continue with the community engagement work up until the end of September, and we expect the new programme to begin in October. And as I said, we've done a whole range of different work, and we continue to do that throughout September. So, for example, we're working and quite a bit of work with our Orthodox Jewish communities, with rabbis and community groups around trying to improve vaccine confidence and uptake. And at the request of rabbis, we're going to be physically doing pop-ups within synagogues, because that's what they've requested. So we'll continue that piece of work until the end of March. In terms of children and young people, this has been a moving feast, probably a daily moving feast. So I'll start with the higher cohort. So those aged 17 years and 9 months are essentially treated as adults and 18 plus. So they're entitled to both vaccinations. They can book through the National Booking Service. They can walk in, they can go to any site, and they will be vaccinated. So all sites are able to vaccinate those who are 17 years and 9 months. Those who are 16 years and up to 9 months, 17 years and 9 months, between 16 years and 17 years and 9 months, are entitled to one vaccine at the moment. So the Joint Committee of Vaccination Immunisations has recommended one vaccine at the moment. Unfortunately, they can't use the national booking system because you have to book 2 doses on that at the moment. That's the way the system works. So it's all the communications has been very much geared around walking into either a local vaccination site, or now some of our pharmacies have been authorised to vaccinate 16 to 17-year-olds. So you'll have seen a lot of publicity. There was a lot of publicity just the weekend that's gone around this cohort to try and get them to be vaccinated. And I think I've asked for local data from NEL. I think across NEL we might be about 30%, but as I said, I've asked for local data for this group. JCVI have yet to report on whether this group would have a second vaccination. And it's all about balancing the benefit versus the risk. In terms of 12 to 15-year-olds, so we've had the 12 to 15-year-olds who are at risk of infection and or who are in household contact with immunocompromised. So that they're entitled to both doses. That programme has commenced. Staff at both our local vaccination sites have undertaken additional training to ensure that they are ready to vaccinate this cohort. And according to North Central London, uptake is very high amongst this cohort. So we're expecting similar high uptake here. So that continues. The 12 to 15-year-old universal, so this is all 12 to 15-year-olds who are outside of that at risk of infection cohort. We were expecting an announcement this week. JCVI met this week. They haven't made an announcement yet. What they did make an announcement on was that anybody who's severely immunocompromised, who is 12 years or older, will be entitled to what's called a third dose. So they're not calling it a booster, they're calling it a third dose. People who are severely immunocompromised presumably have less response and therefore require that third dose to enable them to have a similar response to those who have 2 doses. According to NEL, we should expect an announcement on the 12 to 15 universal either tomorrow or Monday. Certainly sometime next week, an announcement is expected around the 12 to 15 universal. The expectation is that there will be a programme, so we are planning on the basis that that programme will take place. In terms of the 18 to 25-year-olds, when this cohort was initially opened up to be eligible for the vaccine, we did see an increase in activity. And then what's happened nationally is that we've seen that fall off a cliff edge, basically. So it dropped severely in terms of those coming forward for the first dose. So there's been a huge amount of publicity around 18 to 25-year-olds. You'll have seen various vaccination events at festivals and nightclubs and all sorts of things. So we've been working as a system about what we need to do locally for our 18 to 25-year-olds in terms of a communication engagement plan, and how best to access those. So we're working through that at the moment, and that's very much a system response to 18 to 25-year-olds. As you know, the JCVI have also been expected to report on what a booster campaign looks like. And given that the NHS letter came out on the 1st of July, and I've put those cohorts in the paper, those are out of date. So we're not really sure what the cohorts are going to be. I think there is definitely a lack of consensus within JCVI about what that should look like. So different countries have taken a different approach to this cohort. According to NEL, we should expect to receive an announcement on the booster programme on the 14th of September, with a view to that commencing either the 20th or the 27th of September. So that's the latest information I have for you on those different elements.
Thank you, Graham. A very detailed canter through all that's going on. I noticed Councillor Kennedy's had to leave. I know he's been doing some work on this, and obviously I'm really pleased to hear about a programme going through to March. I think that's really, really important. Does that include you, Graham, without putting you too much on the spot? Do we have your resource or an equivalent kind of continuing doing the coordination? It looks like Siobhan might want to come in and rescue me and you in that remark, but that's also been really important. Thank you, Annie. Really important. I just also wanted to add, I really welcome the idea of focusing in on the younger cohort as much as I welcome the additional work with community groups. And the new programme that's going to be launched for HCVA. I do worry about the gap between the two. I think I've said it in many places that if you look about the organisations that we've been working with over the last 3 to 4 months, they don't necessarily reach young people. There are some amazing organisations and networks, and we've obviously done the insight work that we presented with La Brea and the on the curb work with Camden as well. I'm just really conscious that we need to make sure that we're targeting young people in a way that they told us they wanted to be targeted. And I think we can, there's dangers in assuming some of that going to pubs and clubs thing is the right way to go when you look at some of the data you presented in the main report, Graham. Siobhan's now on the phone. I don't know if we can go. Possibly not. Siobhan.
Sorry, yes. Yeah, it is a bit, whilst Graham, I think Graham has, I don't want to speak for him, but Graham has got other fish to fry, shall we say, and won't be with the programme to the end of March, but we will be continuing to fund that level of capacity in delivery, I should, in terms of continuing with the programme, because it is something that we're going to have to continue to do and resource. So that I just wanted to say that, really.
Thank you.
I think Graham can probably pick up about the young people engagement piece.
Yeah, so we've been very cognizant of that issue, Chair, and so we've been working. So although it's managed through HCVS, we have been definitely working with a wider reach in terms of ensuring that we are kind of almost headhunting community groups that work with 18 to 25-year-olds. So I take your point around pubs and clubs. That's why we're very much trying to engage with community groups who do work with people with 18 to 25 and be very much guided by them around what that engagement looks like. So when a community group is commissioned, the engagement is very much led by them, and because they know those communities much better than I do. So yes, the pubs and clubs, I think, was just an example of where other places have tried to reach into various communities, I think.
Thank you. Really reassuring in terms of the resource. Do Public Health want to add anything? I think we could all go on all night and replicate a outbreak board or the ICB. So I'm tempted not to do that given the time. But is there anything else that sort of Public Health colleagues would want to add? No. Thank you. Well, thanks, Graham, for both the paper and the discussion and the focus. And I think the most reassuring thing is that community focus is going to go on through to March. And be resourced, as Siobhan has said, so that's great. Jackie, last but not least, take the floor.
I can be very brief. You will have all seen the briefing paper, which is seeking the board's endorsement for us to submit an expression of interest to the Department for Education to take part in their Family Hub's Grown Up Well project, which it's not a lot of money. If we're successful, there's only 5 spots in terms of local authorities. It would initially be a £30,000 a grant for us to fund a post to enable us to make greater use of our data. The wider project, the wider ambition is around creating family hubs that are both around physical locations but enabling the digital environment and to support families in a different way. So so we'd love to put an expression of interest in and are seeking the board's endorsement to enable us to do that.
Thanks, Jackie. And the recommendations are note, approve and support and agree that we would stay involved and provide that oversight and input, which I think is absolutely excellent. I wonder if there is an opportunity either as the bid goes in, but just to emphasise our wish to work across communities. I think that's been the theme of this afternoon, and the insight that they bring, and that could add power to our bid. So that would be my plea, I think. Any other comments or questions? Are we happy to endorse? I think we're happy to endorse.
Lovely. Thank you very much.
Jackie. I really appreciate that. I haven't been notified of any AOB. I don't see any hands up. Thank you for your sort of forbearance for the 2 hours and 10 minutes. We covered a huge amount of ground, and thank you for attending as always. We lost Rosemary during the discussion, so I'm just, if colleagues could make sure that Rosemary wasn't having difficulties when she put her hand up, and obviously we weren't able to bring her back in, that would be useful. And just thanks very much, and look forward to Dr. Ricketts taking this wonderful chair at our next meeting in November, when obviously we've got a community safety bent. So thank you very much indeed.